Hello everybody, this is Margareta Harris in Geneva, welcoming you today, October 21, to our global COVID-19 press conference. Speaking today will be, as ever, Dr. Tedros Adhanom Ghebreyesus, but as today's press conference has a special focus on health and care workers as well as vaccine equity, Dr. Tedros will be joined by Mr. Gordon Brown, the WHO Ambassador for Global Health Financing, who will speak on vaccine equity, and Ms. Annette Kennedy, President of the International Council of Nurses, and Dr. Heidi Stenschmeiren, President of the World Medical Association. And of course, we have, as usual, our full team of experts available to answer your COVID-19 questions during the question and answer session in the room here. We have Dr. Susanna Jakob, the WHO Deputy Director General, and we have Dr. Mike Ryan, who will be joining us soon, who's the Executive Director of World Health Emergencies, Dr. Bruce Aylward, lead for the ACT Accelerator, Dr. Mariangela Shimau, our Assistant Director General, Access to Medicines and Other Health Products, and Mr. James Campbell, Director for the Health Workforce Department. And we will also have experts joining us online. We've got a very full and interesting program, and as ever, we will have a team providing simultaneous translation in the 6 official UN languages, plus Portuguese and Hindi, and so you may ask your questions in those languages. But now, as I said, we have a very full program. Without further ado, I will hand over to Dr. Tedros for his opening remarks. Dr. Tedros, you have the floor.
Thank you, Margareta. Good morning, good afternoon, and good evening. I have often said that universal health coverage and health security are 2 sides of the same coin. Both depend on health systems that are resilient, efficient, and effective, and able to surge to respond to emergencies. Health systems like that are a vital first line of defense against outbreaks with epidemic and pandemic potential. But they're also essential for promoting health, preventive communicable and non-communicable diseases, and for reducing inequalities and inequities. This week, WHO published a new position paper on building resilient health systems at the foundation of socioeconomic recovery and development. The position paper outlines 7 policy recommendations with specific actions in each area. We urge all countries to implement these recommendations and reap their benefits. The backbone of every health system is its workforce, the people who deliver the services on which we rely at some point in our lives. The pandemic is a powerful demonstration of just how much we rely on health workers and how vulnerable we all are when the people who protect our health are themselves unprotected. A new WHO working paper estimates that 115,000 health workers may have died from COVID-19 between January 2020 and May this year. That's why it's essential that health workers are prioritized for vaccination. Data from 119 countries suggests that on average, 2 in 5 health and care workers globally are fully vaccinated. But of course, that average masks huge differences across regions and economic groupings. In Africa, less than 1 in 10 health workers have been fully vaccinated. Meanwhile, in most high-income countries, more than 80% of health workers are fully vaccinated. Today, WHO and several partner organizations have issued a statement calling for action to protect health and care workers around the world. First, we call on all countries to improve monitoring and reporting of infections and deaths among health and care workers. Second, we call on all countries to ensure all health and care workers are protected and supported with safe and healthy working conditions, regular salaries, pay equity, appropriate education, career opportunities, and social protection. Third, we call on all countries to ensure that all health and care workers in every country are prioritized for COVID-19 vaccines alongside other at-risk groups. Today, I'm pleased to be joined by two women who represent millions of health workers around the world. Dr. Annette Kennedy, President of the International Council of Nurses, and Dr. Heidi Stensmeieren, the President of the World Medical Association, which represents the world's physicians. Thank you both for joining us. Annette, you have the floor, and then we will hear from Heidi. Annette?
Dr. Kennedy, you have to unmute, please.
You have to unmute, Annette.
I tried.
Now, yes, that's good.
We okay now?
Yes, you're okay. Please.
Thank you, Dr. Tedros, and thank you, WHO, for giving me the opportunity to speak on behalf of the International Council of Nurses and on behalf of the 27 million nurses that I represent. I wish it was a better day today. I wish it was a day that we would celebrate that all healthcare workers had been vaccinated or that we had come to the end of COVID-19. But it is not that day. It is a day when we are hearing about 115,000 health workers who have died, many needlessly, many we could have saved. And we know from ICN that that's an underestimate of the number that have actually died. We welcome the publication of the data, but we still grieve for those who have lost their lives. They have sacrificed their lives for other people that they have tried to save. Is it that healthcare workers' lives mean so little? Is that we cannot look after them and protect them? Is it that governments do not realize that they have a duty of care to their health workers, the most valuable resource? It's a shocking indictment of governments. It's a shocking indictment of their lack of duty of care to protect healthcare care workers who have paid the ultimate sacrifice with their lives. Nurses, and I speak for nurses, although we're talking about all healthcare workers, went into this pandemic with 6 million nurses short. Not alone that, but globally, the world was not prepared for the pandemic. We had weak health systems, it had unresilient health systems. And now we find that nurses have left orphan children and they have left many family members behind without compensation or without recompense because it's not looked as an occupational health injury. We have been calling for systematic standardized data collection for over a year and a half. We know from our associations, 135 associations throughout the world, that many nurses have become infected and many have died. We also know that nurses are burnt out. They have given their all for a year and a half or 2 years. They have worked long hours. They have worked without breaks, and they have been called to do a duty without protective equipment and without support. They are now burnt out. They're devastated. They are physically and mentally exhausted. And there is a prediction that 10% of them will leave within a very short time. Add to the 6 million nurses that we are short. Our estimates show that in the next 10 years or less, that we will lose 4.7 million nurses who are due to retire before 2020, mainly from the North America and from the European countries. That makes 10.7 million nurses. Add 10% more to that, from the associations that we know that have said there is an intention of at least 10% who will leave the profession. That makes 13 million nurses. 13 million is 50% of the current workforce. No health system can survive without that many nurses. No health system can even function without 50% of its workforce. And we have seen that nurses are now going into different jobs already. The most educated of our profession are looking for agency work so that they can make 2, 3, and 4 times the salary, but work a third of the time. That reduces the number in the workforce. So, what are governments going to do? What are they going to do to protect our workforce? If you were to see a plane crash every day for a week, an industry would close down. In fact, the world would be investigating it. Yet there's no investigation to the 115,000 healthcare workers who have died. Are we not valuable? Are we not valuable to society? Are we not valuable because we put our lives at risks? There is something seriously wrong, and we all have responsibility. And what we will find is that the lack of sharing of vaccines across the world, because countries are only vaccinating their own, and they're going into booster doses, and they have vaccines that have not been used because they have a choice, and they have decided that through misinformation or disinformation, they're not using their vaccines. But they are left unused, and yet we have other countries crying out for vaccines, particularly healthcare workers. And yet those same countries will be aggressively recruiting very quickly nurses from those countries who cannot afford to lose their nurses or their healthcare workers. So I am sad. I am devastated. I am upset that so many people have lost their lives and that still our governments fail to protect the healthcare workers that they need most. So when is this going to stop? When are they going to stand up to the plate and take their responsibilities seriously? They need to vaccinate all their healthcare workers. They need to invest and they need to retain their health workforce. So I urge all governments, I urge all people, and I even urge the media to ensure that we make this clear. There is another crisis coming down the tracks, and that is a shortage of healthcare workers. Thank you.
Thank you, Annette. And Heidi, over to you.
Thank you, Dr. Tedros, and thank you for the invitation to speak on behalf of the World Health Professional Alliance and the World Health Medical Association. Thank you especially for the support of the necessity to vaccinate health and care workers, individuals who are not only left alone in frontline, but not always heard. So with those words, we want to put forward that we thank the WHO for the initiative raised and regret together with you that many member nations have not provided the data necessary to really document and understand the impact of the pandemic on health personnel and health care. Data, aggregated data, is a resource needed so that we can be more resilient now and in the future. We have learned to use data, and we do have the possibility to collect data. Then it's time that it's being done. We have all experienced and witnessed the harm the pandemic has done, not only to our patients, but also to us and our colleagues, many of which we have seen suffering or even dying. Some still left with long COVID problems. Left alone with shortages in material, often due to disrupted supply chains or unfortunately even hoarding. Left alone with staff shortages, unfortunately insufficient staffing already before the pandemic, but during the pandemic getting really worse. So both material shortages and staff shortages are partly consequences of economic planning and regimes, which have squeezed out the last reserves of healthcare systems. And as I mentioned before, we saw it even before the pandemic, and we also had knowledge about it. On-demand delivery left the systems with lack of resource. We were not resilient enough when the pandemic hit us. Those priorities, political priorities and choices turned out to be extremely costly, not only with a view to many lives lost, but also in the view of the economy and the health and welfare of our countries. Because healthcare is not a commodity to be acquired at the lowest price possible. Healthcare, including reserve capacities, are investments to the future. It's an insurance. It's the way we can be more resilient, just as you mentioned opening this meeting. So back to the working conditions. Working conditions, as pointed out earlier, has been inappropriate during the pandemic, and even the payment of the work during the pandemic has led to a higher attrition rate, and we will see even higher attrition in the future. This will be an obstacle and a challenge to achieve the necessary accessibility to the populations around the world, accessibility to healthcare. And unfortunately, to this we can add attacks and harassments to health and care workers during the pandemic. We have addressed this many times, but the calls to protect us against violence have unfortunately been widely ignored. And even here, documentation is important. So back to where I started, collecting data about the spread of public health threats is neither a luxury nor is it a national business. It is essential and it is affecting us all. We owe respect to those colleagues who succumbed during the pandemic in order to serve their patients. They are truly heroes. Their families need our support, but we owe them more. We owe them not to make the same mistakes again. So if there is a revision of the international health regulations coming up, or even better, if there will be a pandemic treaty, collecting and reporting the essential figures to observe, measure, and understand the public health emergency will be crucial, both to control but also to contain it. So we will say that complete, correct, and instant reporting should be part of our international collaboration. The WHO offers the right platform for this, and we would encourage all countries in the world to stand up for this. Without that, beating future pandemic will be more difficult, and with the risk of repeating what we have seen the last 2 years. Thank you for this.
Thank you, Heidi, and also thank you to Annette, and thank you to both of your organizations also for your continuing partnership to the International Council of Nurses and to World Medical Association. More than 10 months since the first vaccines were approved, the fact that millions of health workers still haven't been vaccinated is an indictment on the countries and companies that control the global supply of vaccines. High and upper middle income countries have now administered almost half as many booster shots as the total number of vaccines administered in low income countries. In 10 days' time, 20 people will meet in Rome with the ability to change that, the leaders of the G20 countries. Between now and then, roughly 500 million vaccine doses will be produced. That's the amount of additional doses we need to achieve our target of vaccinating 40% of the population of every country by the end of the year. 82 countries are at risk of missing that target. For 3/4 of those countries, it is simply a problem of insufficient supply. The other quarter of countries have some limitations in their ability to absorb vaccines, and we're working to address those problems. The target is reachable, but only if the countries and companies that control supply match their statements with actions right now. The barrier is not production. The barriers are politics and profit. The G20 countries have pledged to donate more than 1.2 billion doses to COVAX. So far, only 150 million have been delivered. For most donations, we have no timeline. We don't know what's coming and when. Manufacturers have not told us how much COVAX will receive or when we will receive it. We cannot have equity without transparency. Ahead of the G20 summit next week, we plan to publish new 12-month strategic plan and budget for the ACT Accelerator, which will set out the actions and resources needed to achieve our targets. It's clear what needs to happen. The countries that have already reached the 40% target, which includes all the G20 countries, must give their spot in the vaccine delivery queue to COVAX and Abbott. The G20 countries must fulfill their dose-sharing commitments immediately. Manufacturers must prioritize and fulfill their contracts with COVAX and Abbott as a matter of urgency, and be far more transparent about what's going where. And they must share know-how, technology, licenses, and waive intellectual property rights. We're not asking for charity. We're calling for a common-sense investment in the global recovery. COVAX has the money and contacts to buy vaccines. What we don't have is any visibility on when the manufacturers will deliver. One of the clearest and strongest voices for the need to invest in vaccine equity is Gordon Brown, the former Prime Minister of the United Kingdom and WHO's Ambassador for Global Health Financing. And it's my great pleasure to welcome Gordon today. And Gordon, thank you for your continuing work and partnership and leadership. You have the floor.
Thank you. I want to start by thanking Annette and Heidi for their moving and challenging statements about the loss of 115,000 health workers so tragically lost during this COVID crisis. I count it a privilege to work with Dr. Tedros, who's just introduced me, and with his brilliant, dedicated team. And I'm here today to issue a warning that in the ongoing race we are in between the virus and vaccines, we're once again at a moment of truth. And the next 10 days to October the 31st will be decisive. If at the G20 summit in Italy, the world's richest countries cannot mobilize an extraordinary and expedited airlift of doses to the unvaccinated and unprotected of the world, and do so starting immediately, an epidemiological, economic, and ethical dereliction of duty will shame us all. And we may have lost our last chance before winter to initiate what is urgently needed to save hundreds of thousands of lives, a globally coordinated, month-by-month operational plan and timetable that transfers what are unused vaccines we now hold in the richest countries of the world to the world's poorest countries that are in desperate need, as Dr. Tedros has said, of vaccines now. For it's urgent we close this yawning and unconscionable gap between the promises of vaccines that our richest countries have made and the painfully slow delivery of them to the poorest. And it's time to bring to an end a tragic and unacceptable but still growing divide between global north and global south, that by December, on current projections, the West will be stockpiling 600 million unused vaccines, and by February, almost 1 billion, that could, starting today, if airlifted to the south, help prevent the loss of lives. To have the vaccines available in one half of the world and yet to deny them to the other half of the world is one of the greatest international public policy failures imaginable. And it's a moral catastrophe of historic proportions that will shock future generations. For if the G20, who hold the lion's share of vaccines, do not act to switch their stockpiled vaccines and delivery contracts from north to south, the World Health Organization's latest forecast is that there will be 200 million more COVID cases in the next year, 3/4 of them in the countries where most remain unvaccinated and unprotected, and 5 million lives hang in the balance. And if this were to be the case, we are only a little more than halfway through the damage caused by this pandemic. Now, in face of this crisis, with only 5% of adults vaccinated in Africa, just 1.4% in low-income countries, the first target of 10% vaccinated in all countries was not met by deadline day, September 30th. 56 countries did not reach 10%, 18 countries managed no more than 1% vaccinated. The failure is such that having made a promise to meet that September deadline, we're in mid-October still 200 million vaccines short. And the 40% adult vaccination target for December, confirmed only a few weeks ago at the Global Vaccine Summit, chaired to his great credit by President Biden, has, unless we act now, no chance of being met. Despite the heroic work of COVAX, the bulk purchasing agency, we still appear to be 500 million vaccines short to reach that 40% target. Now, since the start of the pandemic, the number of COVID cases has reached 242 million. And we'll say the World Health Organization almost double again to 440 million in 2022. The death toll is officially now at 4.9 million, and it could virtually double to an overall figure of nearly 10 million within the next year or more. So failing to vaccinate the world is self-defeating. It's against our self-interest. It's against all our security interests. The longer vaccine inequity persists, the more the virus will keep circulating and mutating, the greater the likelihood of the pandemic continuing uninhibited for at least another year, delaying our containment of COVID, prolonging the economic and social disruption the virus is causing. Now, Airfinity, the expert data research agency, are showing us that even if we account for boosters and vaccinating the over 12s and even younger, 240 million vaccines are lying today unused in the West. If we do not act and use them, the figure of vaccines either unused or about to be delivered under contract will exceed 400 million next month. By the end of December, 600 million. So the 500 million shortfall in vaccines that we've talked about can be bridged by transferring 500 million unused vaccines south by switching delivery contracts to do so. By February, the unused stock could be 1 billion. And what is more, Airfinity estimate that if we do not transfer these vaccines quickly, 100 million of these vaccines could pass their use-by date and expire and would have to be destroyed and wasted. But there is a way forward. In advance of the G20 on October the 30th, Western leaders should decide on a plan and a timetable to transfer the vaccines that are available from north to south. If this was agreed, then the other G20 members who also have unused vaccines could be persuaded to add their vaccines and switch their delivery contracts. And this would enable us to reach 40% vaccination rates in all countries by December. So we are now in a countdown to the start of the G20 under Prime Minister Draghi. The G20 is our chance to agree and coordinate an operational plan and a timetable to meet our vaccine targets and to make progress where previously we've fallen short. And of course, an extraordinary humanitarian effort is also needed, as Dr. Tedros has so eloquently said, with the World Bank, IMF, and other agencies making additional resources available to Act A and to the 91 hardest pressed countries to build the medical capacity they need and the staffing to administer the vaccines in urban and rural areas over the coming months. But friends, the alternative is unthinkable. A fractured world where bitterness at a two-track future grows and where the disease spreads uninhibited in unprotected places. And then as it mutates, new variants threaten to infect even the fully vaccinated. It's in everybody's interest. And there is no greater cause today than us acting decisively now to bridge the unacceptable divide between the world's vaccine rich and the world's vaccine poor. Thank you very much.
Thank you so much indeed, Gordon, for your leadership and advocacy. We can only hope the G20 countries hear your call. So thank you so much again, and I hope you will stay with us for the interaction with the media. And Margaret, back to you.
Thank you very much, Dr. Tedros, and to our distinguished speakers. As Dr. Tedros said, we will now open the floor to questions. We've got a lot of you online with your hands up already, so please keep your questions short. Please keep to one question. We will start with Antonio from the Spanish news agency EFE. Antonio, unmute yourself and ask your question.
Hello, good afternoon. To start, well, I want to send my condolences to the health workers all over the world that for all these many lives lost. My question is on another topic. It's on the election of the Director General of WHO. The nomination deadline ended a month ago, but we still don't know how many candidates there are, who they are, or whether Dr. Tedros is going to run for re-election. So can you please give us some information on this process? Thank you very much.
Okay, thank you. I cannot go into details because of many reasons, but it will be announced at the end of this month. Thank you.
Thank you, Dr. Tedros. So that was short. The next question goes to Corinne Bloomberg from Bloomberg News Agency. Sorry, Corinne, please unmute yourself and ask your question.
Hi, thank you. How concerned are you about the surge in cases in the UK? Do you think we are in for another winter of potential lockdowns in places that either aren't using protective measures like masks or that don't have high vaccination rates?
Thank you, Corinne. I think that's Dr. Mike Ryan who will answer that question.
I think, first of all, the United Kingdom has achieved very high levels of vaccination across the board and in all its target populations, including health workers, and congratulations to them for that. The National Health Service has held up very well under a year and a half more than a year and a half of extreme pressure, and our respect to the health workers and to the managers and others who've kept that system running so well through such a difficult and demanding period. There is no question, if you look across Europe, and it's all the way from Azerbaijan to my own country, Ireland, we've seen an uptake in the number of reported cases in a large number of countries. In fact, the trend in Europe has been upwards for 3 weeks, and the UK is no different in that. In fact, the increase in cases week on week in the UK is much less than the week on week increase in some countries in Eastern Europe, for example. But we're seeing that general trend. I think what we're seeing is, in essence, communities going back to what people consider as normal. Restrictions have been progressively lifted in many countries in stages over the last number of months. Most of those restrictions are now not in place anymore in many countries, and we're seeing that coincide with the winter period in which people are moving inside as the cold snaps appear. So in that sense, there is more social mixing, there is more movement, and when you have more social mixing and more movement in the presence of a virus that spreads by the respiratory route, then you're going to get more cases. That's a reality. We know that the vaccines that are being used are highly effective at preventing severe disease and hospitalization. And we can see that decoupling of the incidence data, the number of cases from the number of hospitalizations and deaths. And particularly in the UK, it's really instructive to look at the curve, that despite the increase in number of cases over the last couple of weeks, we've seen a very flat and number of cases of hospitalization, severe disease and death. So that is definitely holding. But the vaccines are not perfect in preventing further infection or in preventing transmission. So the reality is that in a situation where there is intense social mixing in a winter period with people inside, we are going to see further transmission of the virus. The question is whether that transmission turns into severe cases, hospitalizations and deaths. And the way that the hospitalizations and deaths can be avoided is ensuring that those, particularly those people in high-risk groups, have the appropriate vaccination. And that, again, is the tragedy that's been outlined here by so many speakers. The fact that countries like the United Kingdom and many countries in the European Union are able to decouple the incidence from the deaths speaks to the value of the vaccines and the job that the vaccines are actually doing. The issue is that that benefit is not available to so many millions of people in so many countries, including those health workers in countries all around the world. So we will expect to see increases in cases. The question remains as to whether or not we will have the same experience as last year, with health systems coming once again under pressure. And again, if you look to Eastern Europe, and I think in the Russian Federation yesterday, they had the highest number of hospital of deaths in a very, very long time. So this is not just a phenomenon in one place. This is a phenomenon across many countries. And the difference between having intense transmission with some cases of hospitalization and death and having large-scale hospitalization and death associated with pressure on the health system really comes down to vaccination and getting vaccines into people and having people increase their demand for those vaccines. That doesn't mean that we don't have to be careful. This is still a very dangerous virus, and we can protect ourselves. And if you're a person who has high vulnerability, then even if you are doubly vaccinated or vaccinated with the appropriate number of doses in your primary course, you should still be careful. You should still take care. And that doesn't in any way we also have influenza and respiratory syncytial virus. We are seeing unusual activity in both of those viruses as those infections kick back in. We've had a holiday from those viruses in a way, with all the measures put in place for SARS-CoV-2 and COVID. We've had very low incidence of those two diseases. So again, I would advise people to make sure that if it is offered that you get the influenza vaccine as well this winter for those in the Northern Hemisphere, and that you protect yourself against that as well. So again, just to say, the United Kingdom has not only been part of developing vaccines, but has also delivered those vaccines very effectively to its population. Its NHS has stood up well. And I believe the Health Minister yesterday and others have put in place contingency plans for further measures should they be needed. And I think all countries need to be considering what they will need to do to support their health service should the incidence of disease result in higher numbers of hospitalizations. That's just good planning. And ensure that we get particularly, and I think this is one issue, sometimes we look at this number of the percentage of people vaccinated. That's not necessarily the most important number. It's the people you've missed in the high-risk groups. They're the ones who will get sickest. They're the ones who may die. So please, let us not focus purely on the number of people vaccinated or the proportion. Let's look at the people who we need to vaccinate at an absolutely highest priority, and have we covered those people, especially those with underlying conditions and older persons. Thank you.
Thank you, Dr. Ryan. And I think Dr. Aylward wants to add something.
I think we can move on, but it was just the point that the Director General and Mike emphasized so often. We don't have to see those surges. The vaccines are an important part of it, but the vaccines are only part of the issue. That social distancing, the masking, etc. We've had lots of countries try to mix the vaccination high coverage with those other measures that Mike and Director General emphasized so much, and that's what we have to remember again and again and again. It's not an inevitability to have big surges of disease. It's a function of how we behave in the face of this virus as well.
Thank you, Dr. Aylward. I'm looking around the room to see if any of our experts on health systems would like to point out what this means for the healthcare workers. No. Okay. So then the next question will go to Gunilla from Svenska Media. Gunilla, please unmute yourself and ask your question.
Thank you for taking my question. And first of all, my condolences to all health workers in the world. Then my question concerns vaccines. All Nordic countries have actually suspended the use of Moderna vaccine for people under 30 years of age after a new study about heart inflammation. I'd like to have your view on this. Is this a reasonable decision? What is the risk of giving the Moderna vaccine to younger people considering this new data? And can younger Nordics who already have taken one dose of Moderna now safely do a mix and match and take Pfizer? I think you have been preparing a statement on after you're reviewing this data, but so far I have not seen anything. Thank you.
Thank you, Gunilla. Dr. Mariangela Shamau will answer your question.
Thank you, Gunilla. First of all, let me say the WHO has a global advisory group on vaccine safety that meets regularly, and it's currently assessing the decision in Sweden and Denmark to stop vaccinating with the Moderna vaccine and comparing the very rare, actually let me again reemphasize the very rare side effect, adverse event of myocarditis in younger people, especially 18 to 24 years of age, and who have taken either the Moderna or the Pfizer vaccine. So this is, again, these vaccines, first of all, the myocarditis, as has been observed, is very benign. Some people do have to be hospitalized, but we don't have any deaths associated with it. In the assessment we have so far from the different regulatory agencies and also the internal assessment of WHO, that the risk-benefit of having the benefits of having the vaccine still outweigh the risks. So we shall be seeing a statement of the Global Advisory Group on Vaccine Safety in the next few days. Thank you.
Thank you very much, Dr. Shamal. The next question goes to Jeremy from RFI. Jeremy, please unmute yourself and ask your question.
Thank you, Margaret. I would like to ask a question about the nurses. I was wondering, regarding health workers, does WHO recommend or is working on recommendations for health workers to receive a third dose? And if Ms. Kennedy is still online, I would like to know if that's a demand from the nurses themselves. Thanks.
Thank you very much. We'll go to Annette, I think, first of all, and then Dr. James Campbell will answer.
I think if I heard you correctly, you're asking if healthcare workers like nurses should get a third dose. Is that what I heard?
Correct.
Of course, if we are talking about the safety of healthcare workers, we would agree with what the evidence suggests. However, what we are saying too is we would like to see equity in distribution of vaccines across the world, not just in high-income countries receiving vaccines, 2 vaccines or 3 vaccines or booster doses. That would be ICN's ethos in relation to healthcare workers. It's equity of vaccines across the world to protect everybody. So that's where ICN would be coming from. But of course, we would do everything in our power to protect the healthcare workers because we need them. A loss of one more life is a loss too much.
Thank you very much. Dr. Aylward, would you like to add anything on that, or that's fine? Okay, so the next question goes to Gabriela Sotomayor from Proceso, Mexico. Gabriela, please unmute yourself and ask your question.
Thank you very much for taking my question, and my condolences to all the health workers in the world. My question is to Dr. Tedros. The president of Mexico, Mr. Andrés Manuel López Obrador, expressed harsh criticism against the WHO because of the delay on the authorization of emergency use of certain vaccines. At his press conference, he criticized the organization for its inefficiency and asked you to accelerate the process to authorize the use of certain vaccines, for example, the Sputnik or CanSino. This is the second time that he puts pressure on the WHO to hurry with the process of vaccine authorization, and he questioned if the reason was political or ideological. So I kindly ask for your comments. Thank you.
I was going to say, perhaps Dr. Shamal will begin.
Thank you, Gabriela. This is an important question because actually, let me make very clear that WHO use international standards, and the procedures that guide the emergency use listing are published in WHO's website, and they are followed by all manufacturers. So But the procedures don't, in themselves, they are procedures, right? What needs to happen is that the manufacturer needs to apply for, needs to do a submission to WHO, and then once it's accepted, it needs to submit all data, and data, like I'm saying, WHO is not inventing new data or creating differential requirements. We use the internationally accepted, recognized standards and norms for the quality and safety of health products. And then the speed with which the vaccines are listed, which is the emergency use listing, depends on how fast the manufacturer submits all the data. And in some cases, we do need to do inspections in the manufacturers. If the inspection was recent, we don't need to do it again. But so in the case specifically of the emergency use listing of Sputnik that was mentioned, let me say that we did start what we call the rolling submission, which means that the applicant starts to upload in WHO's website the data, the technical data, clinical data, the clinical trials, the good manufacturing practices, the quality management system. There's a series of data that needs to come in. We haven't received all the submission from Sputnik yet. And let me say that the process was on hold until yesterday evening because of a legal procedure. We still needed the applicant to sign that they agreed to the WHO's rules and procedures to continue to do the assessment. So it has restarted as of today. And so we expect that we will be able to redo the inspections in the next few weeks, and also we are still going to receive additional data from the Sputnik applicant. So this is the process that works for everyone, so there's no differential. WHO doesn't differentiate from where the manufacturer is, which country it is, whether it's this or that, state-owned or private sector. We follow the rules that are equal to everyone. Then there are different timelines because of the different processes in terms of the speed with which the manufacturer can provide the data to WHO. Thank you.
Yeah, thank you. So she wanted me also to respond, so I'd be happy to say a few words. First of all, we haven't heard from Mexico straight. If they have any concerns, they can ask us, they can send us a message, and we can give them any answer. So this is the first time I'm getting information that they have concerns. And second, if they're interested, they can send experts to see how we do it here. So instead of President really raising these issues without any contact with our experts, first it's better to leave it up to the experts to discuss. And as I offered earlier, if he wants to know, I think he can send experts, and our experts and their experts can discuss. One thing I would like to assure His Excellency the President, though, is we use data and evidence and principles, nothing else. And the final recommendations come from experts with the right skills and experience. So we always use evidence and science. So that's what I would like to assure His Excellency. Thank you.
Thank you very much, Dr. Tedros and Dr. Shimal. And the next question will go to John Zarakostas. John, please unmute yourself and ask your question.
Yes, good afternoon. I'd like to follow up on some of the interventions by the representative from the Nurses Association, the World Medical Association, and if they could shed some light on the tragic situation in Yemen, where health workers have not been paid for many months, more than a year in some cases, and they're treating life-saving cases on the ground, pediatricians, etc. I know the WHO has been trying to do something about it. It would be great to know what is being done, given that 11 million children's lives is at risk there. Thank you.
Thank you, John. I will also go to Dr. Heidi from the World Medical Association, who's also got her hand up, but we'll go to Dr. Annette first.
Thank you for the question. And it's not just in Yemen that this is a problem. We have seen it in many countries throughout the world where there hasn't been investment in health systems, and consequently, nurses are not paid and they're not even employed, even though there's a shortage in those countries. I'm not sure what we can do except to put pressure on governments to invest in their health workforce, because without a health workforce, you don't have a health economic system in country. So I understand that it's not just in Yemen that there is an issue in relation to the delivery of care to children and to the society at large. We're finding it in many, many countries throughout the world. So we have to all put pressure on governments to ensure that there is employment and that people are paid to actually deliver care, and that this is as important as investment in banks or investment in any other area of work, because it seems like healthcare is not as important as, you know, having your money invested in a bank. I mean, really, which is more important, that you die or that you have money in the bank? To me, there's no equation there. So, you know, I am just extraordinarily taken aback that government sees so little reality in the reason to invest in healthcare and to invest in healthcare workforce and to protect the general population. We saw what happened when COVID came. The whole world shut down, the economy shut down, everything shut down. But the only people that could keep going were the healthcare workforce and the hospitals and the institutions to try and protect the people and to save their lives. So it's time that governments learned, and it's time that governments learned a lesson from this pandemic.
Thank you, Dr. Annette. And we'll now go to Dr. Heidi, who had her hand up, I think, for an earlier question. Over to you, Dr. Heidi.
Yes. Thank you so much. Yes, it was for an earlier question, but I'd like to address this as well, because we see it in many countries, and we appeal to the humanity and ethics of the health professionals on the floor. But a country, a society can't build on that, because even they are leaving to save their lives many times. And I just spoke to a colleague in Lebanon, and we see colleague after colleague leaving to other countries. And this we have seen before the pandemic. It has just been worse. And we have to see to that healthcare is part of the infrastructure, just as the health of the population is an asset, not only money in the bank, but is an asset, but healthcare personnel is an asset, an important asset. So it's about politics, about investments, but also about global collaboration. We have to support each other. So yes, we acknowledge the problem, and it is actually very big. So, but what I wanted to ask to your question, the last question, but I wanted to add a former question about vaccines, vaccination of healthcare personnel, third dose, yes or no. And I just like to address the opening remarks by Dr. Tedros, where he pointed out that 2 out of 5 healthcare personnel are not vaccinated yet, or that 2 out of 5 are vaccinated, sorry. And that's a too low number. And there, the healthcare personnel, as physicians, as myself, we have a responsibility to get vaccinated as well. But because between the situation where we do have access to vaccine and the possibility to vaccinate healthcare personnel, and where there is a total lack of vaccines, there is a range in between. There's also a choice of the healthcare personnel. So it is our responsibility as well to get vaccinated we meet vulnerable people all the time, and there's a risk if we are not vaccinated that we carry the spread of the virus to patients. And we are also role models towards the population, and we need to tell the population of the importance of being vaccinated. We also have a role in promoting the right information about vaccines, because there are a lot of misinformation and incorrect information about the vaccine and the pandemic, but also about the spread of the virus. And we need to promote clinical data as fast as possible and as much as possible, so that we and the populations around the globe will accept to be vaccinated as well. That's important to address. Then the question of a third dose is it's coming later. But these to get vaccinated in the first place must have seniority.
Thank you so much. And now Mr. James Campbell will answer this excellent question. Is getting a lot of interest.
Thank you, Margaret. John, thank you very much for the question. Yes, the situation in Yemen is of real concern. You will have seen in today's joint statement, the Healthcare Professional Associations, WHO, many of the partners, ILO included, the second call to action is on the decent work agenda, to ensure that these health and care workers who are putting themselves often in situations of great difficulty, who are having a higher risk of infection and a higher rate of deaths, are in positions where the basic conditions, remuneration included, are being put forward. In the working paper that is published today with the estimates of the deaths, we also present all the other measurement that the data scientists, the epidemiologists here in the organization with member states are conducting. And that includes looking at the negative impact on the work environment. We have seen labor protests in over 80 jurisdictions, many examples of which are due to the work environment, the personal protective equipment, the acceptable levels of risk. It's also to do with the burden of mental illness, the stress, the anxiety that we heard Annette Kennedy, president of the ICN, talk about. So pay, terms and conditions is part of the action, and we're working with our colleagues in Yemen, with the government, to try and find solutions. And as Bruce Aylward and many colleagues are talking about, if we look at the 40% targets, the 70% targets for population coverage, that is going to translate into several million healthcare workers working full-time on vaccination. If we are not paying them, we will not have vaccine equity. And just one comment, if I may, on the either-or question of the third dose. As Gordon Brown gave the presentation earlier, it is not a question of either-or. We can do both. There is enough vaccine supply if we have the political decision-making, all health workers protected, and that includes first, second, and where necessary, third doses. Thank you.
Thank you, Mr. Campbell. And Dr. Susanna Jakob will add some more comments.
Thank you very much. I would like to share the concerns of Annette and Heidi on the need to move towards more resilient health systems. And that will be a very important part of the recovery and the transformation, and that will definitely also include issues around the workforce. And we have been very pleased to release the WHO position paper just 2 days ago in this room on this topic together with Mike. It was a joint work learning from the COVID experience, and many of the ministers joined us in that meeting, and also the regional directors, and they welcomed the timeliness, the relevance, the utility of this integrated approach to move towards UHC and health security together. And there are many actionable recommendations in that paper. One of them is that we have to invest more into the foundation of the health system, which is primary health care, essential public health functions, IHR implementation, integrated approaches, and as there is interdependency between these issues, it is very important to use the primary health care approach as a nexus. We also agreed that we need to invest more into FCV settings, which is the fragile and conflict-ridden countries, and they have to be our priorities, and we have to start intensified or support intensified programs in these countries. One additional element is that if we want to address all these issues around the workforce and other things, we have to invest more into the health systems. And the COVID has made it very clear that health is an investment and not a cost. And all these issues around the workforce are definitely linked to that. So we have already started the discussion how we turn this into an implementation plan in the countries at the 3 levels of the organization, working with the country and regional offices. And in the meantime, also, we implement the guidelines that have been developed by James and his team during the COVID, when we addressed many of the workforce issues and actually adapted lots of the WHO guidelines to the COVID and COVID-related issues. And it's not only a guideline that sits here in Geneva, it's a guideline that we shared with the country offices and are actively implementing it. Thank you.
Thank you so much, Dr. Jakob, for explaining exactly what countries really can do to make the health systems resilient. We've run out of time. The questions were so excellent and the responses so rich. So I'm now going to hand over to Dr. Tedros for his final remarks. Over to you, Dr. Tedros. Pardon? Oh, and over to our speakers to ask if they would like to have any final remarks. Do we have final remarks from our speakers? Yes, Sir Cameron.
Yeah, just very quickly, I suppose what I would like to see is standardized data collection across all countries and fed to WHO. I would like to see implementation of safety and protective measures. And just as an outside, most of the PPEs, all of the PPEs were designed for men, not for women. Yet 90% of nurses are women, 70% of all healthcare workers are women. Interesting that they were designed not safely for women. That there would be mental and physical support, that there would be vaccination for all healthcare workers by the end of the year, and that there would be incentives to retain staff, particularly older staff, nurses in the workforce. And there's lots of recommendations on how to do that, both by ICN and by WHO, and to build capacity in home countries, not to be aggressively recruiting from other countries. And finally, I hope that government have learned a lesson for the future. I'm not convinced yet. Thank you.
May I take the floor?
Please do.
Oh, thank you. Excellent. And I can just say that I support what Annette said. I'd like to add the importance of global collaboration, and that the window of opportunity we have to make substantial change to strengthen the global collaboration should not be overestimated. We might not have that much time, so we need to act now to get the greater support to our initiatives such as the that Gavi has and the WHO. So we must all help each other to urge all countries in the world to support the global institutions who have the mandate to make global collaborations and guidelines, because we need action made, substantial action. And I'd like to thank for the acknowledgement by the WHO to all health and care workers around the world, supporting us, of course, because many healthcare workers are alone in the front line, and it's difficult as healthcare workers to speak for themselves. Many times they're standing there with very sick patients. So it's so important that we acknowledge their role and their vulnerability. And if healthcare is vulnerable in a country, well, then the population and the health will be vulnerable, and then society will be vulnerable. And To become more resilient, we need continuing investments in the health of the population, and healthcare workers are our core for that. So finally, thank you that you highlight the importance of the healthcare workers around the world.
Thank you so much for those comments. Unfortunately, Mr. Gordon Brown has had to go to another meeting, so I'll hand over to Dr. Tedros for his final remarks and to close the press conference.
Okay, thank you, Margarita, and thank you to our guests today, to former Prime Minister Gordon Brown, to Dr. Annette Kennedy, and Dr. Heidi Steinschmeier. I would also like to thank our media colleagues for joining today, and see you in our upcoming pressers. Thank you.